Gastrosurgery UK's Guide to Post-operative Care for Inguinal Hernia Repair. Immediate post-operative period. Recovery room monitoring. After surgery, you will be monitored in a recovery room until the anesthesia wears off. Pain management. Adequate pain relief will be provided. Follow your healthcare provider's instructions for pain medication. Activity and rest. Rest and avoid strain. Rest is crucial in the initial days. Avoid strenuous activities, heavy lifting, or intense physical exertion as advised by your surgeon. Gradual resumption of activities. Begin with gentle walking and gradually increase activity levels as directed by your healthcare provider. Wound care. Keep the incision clean and dry. Follow specific instructions for wound care. Keep the incision site clean and dry to prevent infection. Inspect for signs of infection. Watch for signs of infection, such as increased redness, swelling, warmth, or drainage from the incision. Diet. Gradual resumption of diet. Start with clear liquids and progress to a regular diet as tolerated. High-fiber foods. Include high-fiber foods to prevent constipation, but avoid foods that may cause gas or bloating. Medications. Pain medication. Take prescribed pain medication as directed by your healthcare provider. Bowel regulators. If needed, use stool softeners or mild laxatives to prevent constipation. Follow-up appointments. Schedule and attend follow-up appointments. Attend all post-operative follow-up appointments with your surgeon for wound checks and assessments. Activity restrictions. Avoid heavy lifting. Typically, avoid lifting heavy objects for a specified period, as heavy lifting can strain the surgical site. Gradual resumption of physical activity. Gradually resume physical activities and exercises as advised by your surgeon. Watch for complications. Monitor for signs of complications. Be vigilant for signs of complications, such as persistent pain, swelling, redness, fever, or changes in bowel habits. Contact your healthcare provider if any concerns arise. Driving restrictions. Avoid driving initially. You may need to avoid driving for a specific period, especially if you are taking pain medication. Return to work. Follow work restrictions. Discuss with your surgeon when it is safe to return to work, considering the nature of your job. Always follow the personalized instructions provided by your healthcare team for the best recovery outcomes. If you have any concerns or experience unusual symptoms during the recovery period, promptly contact your healthcare provider.